Hi, I'm Julia Wilson, Executive Director of Pasadena Outpatient here in Knoxville, Tennessee. I wanted to take a few moments and discuss our program and tell you a little bit about what sets us apart from other programs in the area. When creating this program, I had in mind somewhere comfortable, somewhere where I would want to be able to refer family and friends, a place that focused solely on mental health and created a warm and inviting environment. I wanted to create a living room where you could sit around with other people and talk, where you could be vulnerable and where you could get help. Here at our program, we offer 3 different levels of care. We have partial hospitalization, or PHP, intensive outpatient, or IOP, and we have our adolescent outpatient program that meets in the evenings. It's also considered an IOP level of care. At partial hospitalization, you can't let the word hospital scare you. I know it sounds really intense, but the hospitalization piece really means that you're coming for 5 days a week for 6 hours a day. In that 6 hours, you are going to have group therapy, individual therapy. You're going to meet with your psychiatrist and really be able to dive into the world of therapy and take some time to heal. Once you've completed that partial hospitalization level of care, we then like to step people down to our intensive outpatient level. This means that you can meet from 3 to 5 days a week for 3 hours a day, really depending on what you need. So the treatment plan will look at where you've been, what you've been doing, what goals you've met, and what goals you are still trying to meet. And then we will create a schedule that fits your needs. One thing that sets us apart is that we will utilize different modalities that treat your goals depending on what your treatment plan looks like. We utilize DBT, CBT, motivational interviewing. We may use some concepts from EMDR. We use therapeutic movement with our yoga therapist. We like to really be creative and meet the clients where they're at. We found that doing this is a more personalized approach. Instead of having a strict curriculum and strict goals that everyone has to meet, we are individualized. We look at you. What do you need? Where are you going? What are you coming from? How can we help you? And what does healing look like for you? We treat individuals ages 12 to 18 in our adolescent program and ages 18 and up in our adult program. We found that having a combination of ages is really helpful for people. Sometimes people are hesitant. They may think that they are going to be the youngest or the oldest in a group. And then once they're there, they realize that the benefit they have in hearing other people's perspective is immeasurable. So we'd like to invite you for a tour. Come on in. If you're interested in any of our services, we'd like to have you here and show you how comfortable the environment is and that we really care. We mean it. We work here to help you because we know that it works.